Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Kevin Orloski. He's a physiatrist with Mary Free Bed at Covenant. Thank you so much for being here today, Doctor.
Good morning. Thank you for having me.
You're welcome. Okay, so tell us today, we're discussing a little bit about outpatient physiatry services. Before we get into that, tell us a little bit about what that is and what you do, Doctor.
Well, physiatrist, some people have a problem with that name. We're also known as physical medicine and rehabilitation doctors. We help patients or people with anything that affects their physical function. So their ability to walk, use their arms, work, shop, do housework, play sports, whether it's from pain, from an injury, something like a neurologic disorder such as Parkinson's disease, a stroke, spinal cord injury, or just arthritis or back pain or a sports injury.
Okay.
We use various modalities to help patients. We also oversee different kinds of therapies. We do pain management, joint injections, interventional procedures, basically oversee the patient's care from beginning to end, whether they're going to have surgery or any other kind of intervention.
Yeah, so can you give us a few examples of the specialized outpatient treatments that Mary Free Bed now offers in this region, Doctor?
Yes, we do Botox injections to manage spasticity. Spasticity is increased tone or contractures of a muscle, usually in your arms or legs, and that can happen after a stroke with cerebral palsy or after a spinal cord injury. So this can inhibit people from doing things, from walking or using your arms or legs the way they were meant to be. So Botox is a type of medication that will help ease those contractures or lessen the tone of the muscles and improve function, and also reduce pain, because that can be a painful condition as well. We also offer EMG testing, which is nerve conduction and electromyography. This is a special test that can detect nerve injury.
Wow. Now, here's an exciting little tidbit for everyone. You and your team have a new location in Saginaw. Tell us a little bit about that.
We do. We're very excited. We just opened up our new outpatient clinic, which is right across the street from Covenant Hospital. But more importantly, we just broke ground on a new building. We're going to have a new state-of-the-art rehabilitation hospital right on the campus at Covenant that is hooked up to the main hospital. That's expected to open in fall of 2021. And we're also welcoming some new doctors to our practice. I have a partner right now, Dr. Margaret Snow, and we're also going to be welcoming Dr. Ian Gonzalez, who is fellowship trained in pediatric rehab, and Dr. Jennifer Weeks, who is fellowship trained in spinal cord injury. So we're putting together a really good team, and we're going to be able to provide a lot of services to the people of Saginaw.
A highly trained team right in our area. We're excited to hear about that. Now, if someone thinks that they could benefit with you and from your services, how can they connect with you, Doctor?
Well, they can ask their primary care doctor for a referral to Mary Free Bed at Saginaw, Mary Free Bed at Covenant, outpatient services. Or if they don't need a referral, they can call our office directly and schedule an appointment.
Okay, here's the best question of the day. Last question. Tell us why you love what you do. We always love to hear that.
Yeah, there's a lot of reasons. I love what I do every day, helping people. But I guess the most amazing thing is when you have a patient who has some sort of disability. Let's say they're not able to walk, or they can't work anymore because of an illness or an injury, and they can't even do their housework or maybe play a sport that they love. Helping that patient get back, regain their function, and reach their utmost potential so they can, live their life to the fullest. There's nothing more rewarding than that, and we see that every day.
Well, what an amazing job you do, and what a rewarding field of work. Thank you so much for joining us today, Doctor.
Thank you for having me.
You're welcome. And if you would like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.